Hi, I'm Dr. Jaya Kanikar and welcome back to Mind Matters. Today we're going to talk about depression. So all of us experience some amount of sadness in our day-to-day life. So we may have some stressful situation, something happens that we are unhappy about, and that's a part of life. And all of us experience some amount of sadness which persists for a few days, and after that we are generally able to adapt to it and move on. But it is very important to differentiate sadness from depression, because if it is just sadness, then we accept it and we carry on. But if it is depression, then definitely it needs professional help and treatment. So coming to this, the first important qualifier to differentiate between sadness and depression is the time frame. Sadness can be for a few days. You feel sad for a few days and then most of the times you're okay after a few days. But for depression, for us to diagnose it as depression, the symptoms of depression, what I'm going to talk about later on in this video, have to persist for a minimum time period of 2 weeks, which means that for most of the day and almost every day, for a minimum time period of 2 weeks, you have to experience most of the symptoms that I am going to talk about. Only then do we say that it is depression. The second thing is that these symptoms cause significant distress to the individual and they cause a disruption in their normal day-to-day activities. So whether it's their social life, whether it's work, whether it's relationships, there is significant amount of disruption in all of these areas, and the person experiences it as something that is affecting every area of their life. Now coming to the symptoms. The first and most important symptom is low mood, what we call as a pervasive sense of sadness, which means that this person is feeling sad all of the time or almost all of the time. It is pervasive, it does not change with the circumstance. So for most of the duration of the day or for almost every day for a minimum period of 2 weeks, this person is experiencing sadness, and this is not the type of sadness that we experience if we have not experienced depression before. It is a very profound, pervasive sadness. We feel extremely low, our mood is feeling very bad, or sometimes it is really irritable and we just cannot most of the times it's like I'm not in the mood to deal with anything. It's that kind of sadness. The second is a loss of interest in pleasurable activities. Now this varies from individual to individual, which means that any activity that particular person would find pleasurable earlier. So it could be anything. It could be reading, it could be going to the movies, it could be socializing, it could be photography, it could be traveling, anything. But if that particular person really enjoyed these activities before and now they don't have any interest in pursuing it, or sometimes even if they are forced to it, like sometimes what happens as well-wishers, we say, oh look, you're looking really sad and you really enjoy movies, come on, like forcefully the person is taken for a movie or taken out for a cup of coffee or something like that, because we feel that this person likes doing these activities and if only they could just experience that activity again, they will start feeling better. So even if this person is forcefully taken to this activity, their mood does not improve, they do not enjoy this activity at all. That is what we mean when we say lack of interest in activities that were previously pleasurable to this particular person. Next thing is significant weight loss. When the person is not trying to lose weight, which means that they are not dieting, they are not going through any forms of exercise, they are not trying to lose their weight, but there is a significant amount of weight loss that the person is experiencing. This is also accompanied by changes in appetite. Either the person will have no appetite, they will not want to eat anything, or sometimes the person starts eating way more than what they would eat. Insomnia or hypersomnia, which means that either the person will have difficulty sleeping, they have difficulty falling asleep or staying asleep, or they are not able to have a good enough quality of sleep, and when they wake up in the morning they are not fresh. Or hypersomnia, they just want to sleep throughout the night, they want to sleep throughout the day, they are not able to get up, they are not able to go about their day-to-day activities. The next symptom is what we call as psychomotor retardation, which means that this person is now not going to be able to be as active as they were before. So, and this is something that is not only subjective, it's not like only subjectively they feel slow, or even the other way around, sometimes they feel agitated, but this is not subjective. Even others around will notice that now this person is not being as active, prefers to just sit in one place or stay to themselves, they are not having any kind of activity happening, or they are like constantly agitated and trying to move around but not really productive. So that is also a very common symptom that is noted. The next is a complete lack of energy and feeling really easily fatigued. Now suppose consider a person who is very active, they go to work, they manage their house, they do a lot of day-to-day activities, and generally they are a very active person and their day is full of multiple things that they need to get to. But this person now starts saying that I don't have the energy to do anything, I don't feel like doing anything, I'm just going to be sitting because I am just so tired all the time. So this person has low energy and easy fatigue. So even small activities which like suppose this person was handling 10 things in a day, now just doing 2 activities out of those 10 completely drains them out, and they are not able to fulfill all their daily requirements, whatever they were doing on a regular basis earlier. Another thing that's very commonly noticed is a reduced ability to think, to focus, to concentrate, to make decisions. This is experienced by the person themselves and even by the people around. They say, you know, the person will say like, I'm just finding it so difficult to think. I cannot think, I cannot focus on anything. I'm not able to do my work because it takes such a so much of energy which they don't have to be able to focus even on minor things, and then they are just so drained that they cannot concentrate, and this often is perceived by others as memory disturbances. So the relative will say that, you know, suddenly he's become very forgetful, doesn't remember anything, is not able to work, but it's not actually a problem with memory, it is an issue with focus and concentration. The person is not able to focus, their ability to think is diminished. Along with that, many a times people have feelings of hopelessness. It's like they are in this very bad situation, and everything looks really dark and blurry to me, and I don't think it's going to get any better. There is no hope for me, there is nothing about this situation that's going to get better. So hopelessness, the person feels that now this is the end of the world, I am for me, so I am not going to be able to come out of this, and it's always going to be so bad as it seems right now. There is a feeling of helplessness, which means that I cannot do anything to come out of this situation. So I am so helpless that I am in this big problem, there is such a big issue I am facing, but there is nothing that I can do to come out of this situation. Then there is an inherent feeling of worthlessness that comes in. So it's like I am in this bad situation and I deserve to be in this bad situation because I am a bad person. I don't deserve anything better. I don't deserve to be happy. I am a worthless person, and I deserve to be in this exact particular situation that I am in. This often then is followed by constant thoughts about death. Now this is not just like a fear of dying. It is not that, oh, I'm so scared that something is going to happen to me and I'm going to die. No, it is more like a death wish. It's better if I was dead. You know, this whole situation seems so hopeless. I am feeling so helpless, and anyways I don't deserve to have anything better. So I would definitely be better off dead, because then everybody around me also would be happy, because they won't have to deal with me and I won't have to deal with my problems. So there is something what we call as a death wish. So you feel that it's better off, I'm better off being dead. The second thing is suicidal ideation. Then the person starts actively thinking of ending their life, wherein they might start talking about suicide, they might start thinking about ways how to commit suicide, or they might even start putting it into action by figuring out how they are going to commit suicide and getting the necessary preparations done for it. So if anybody is experiencing any of these symptoms, definitely you need to meet a psychiatrist. And if anyone around you is experiencing these symptoms, then you need to make sure that you take them to meet a psychiatrist. Often we experience, patients experience something called as somatic symptoms. Means that they will have this constant headaches or constant body aches or some constant physical symptom, but it is unexplained. They will go to a general physician, they will go to their family doctor, they'll meet multiple doctors, because these symptoms are not getting resolved. Like somebody who has a headache will meet a physician, then they will meet a neurologist or a neurosurgeon. Somebody with constant backache will meet an orthopedician. But these symptoms are unexplained. The investigations all come out fine and the person is not having anything that can cause this kind of symptoms in that. These patients also will constantly keep moving from this doctor to the next, which means that if they are going to one orthopedician, they will go to the next one, the third one, and everyone tells them the same thing, that look, there is nothing really found on the investigations. Many a times these kind of symptoms are the somatic symptoms of depression. So somebody who is experiencing symptoms of depression along with these kind of unexplained physical symptoms, we have to understand that these physical symptoms also might be a part of depression, and when you meet a psychiatrist and get your depression treated, the somatic symptoms will go away by themselves. I hope that this has been quite clear. If you have any questions, please let me know. Please drop your comments below and I will try to answer them as best as possible. Thank you, and as always, be kind to your mind.